Welcome to the professional practice section of our TCRN exam review. As the name implies, over the next little while, we're going to be covering information that isn't so much injury related as it is practice related. So there's a small group of questions, if I remember right, it's 11 questions on the exam centered around professional practice, which is how we carry out our practice. It's not looking at injuries anymore. It's not looking specifically at how we take care of patients, but it's how we practice our care. So that's kind of where we're going to go. Just take a little break from clinical for a little while to cover these professional practice issues. So as always, let's start with a challenge question. Ready? The symptoms of compassion fatigue are most likely to be, so here we go, evident after a single traumatizing experience, transient and worsened during nighttime hours, delayed 3 months or more after the causative incidents, or identified by coworkers before the individual experiencing them. Let's move on now and talk a little bit about that psychological care. And let's specifically focus on the trauma team, caring for the caregiver. You know, I say this and I mean it with all my heart. It's almost impossible to work trauma and not at some point be impacted. It almost feels like you can't be human if you're not, and not be impacted by working trauma all the time. To see day in, day out, patients who are busted up, families who are torn apart, to face death, to face disfigurement. You know, we can be tough as trauma nurses and we can handle a lot, but to think you can go through an entire career and not be impacted just doesn't feel human. All of us need to recognize that the work we do is superhuman. It's something that the majority of our world would not do and could not do, and we're asked to step into a place that most people only see in horror movies, and it's our life. But because we do work in horror movies every day, we have to recognize it's going to impact us, and we are going to be hurt emotionally, and we have to be willing to accept that and to deal with it because we're human, and that's part of what makes us human. We kind of recognize three main psychological impacts that can occur to people who work, who work healthcare overall, but certainly trauma puts you at an even higher risk here, and that is PTSD, compassion fatigue, and burnout. Now, PTSD is a bit unique in that it requires the person to personally experience or witness a terrifying event. It requires that personal attachment. The example I like to use here is you have a nurse working in the trauma unit and a patient suddenly becomes very violent. Maybe they're delirious or whatever, and they jump out of bed and they take an IV pole and they beat one of your coworkers, and you watch it. You try to intervene, but you can't because of the violence of the nature, and you watch your coworker savagely beaten with his IV pole. Now, this happened to you. So what happens in the future? Well, you probably end up taking some time off to recover, but you notice you have real anxiety when it comes back to going to work. You truly are afraid of being injured yourself going back to the workplace. And when you go back to work, you have extreme anxiety. Every time you walk by the room where it happens, you relive the experience. You get sweaty palms and you get a dry mouth. That's just a perfect example of PTSD. You experienced it. You have triggers like going to work or passing the room that cause you to relive and have memories of the event. That's PTSD. Now, the second form of stress management or stress that we'll talk about in the healthcare worker is compassion fatigue. Now, compassion fatigue occurs when a traumatizing event for one person becomes traumatizing for another. So the key here is that in compassion fatigue, you don't personally experience it like you did with PTSD, but you experience it through someone else. You feel the pain through someone else rather than it through yourself. The example I'll use here is, let's say that you have a very difficult pediatric trauma code and the child ends up dying. You're unsuccessful in saving the child, and you have to go out and tell the mother that her child died in the trauma and you weren't able to save the child. And the mother collapses into your arms. She's sobbing uncontrolling, uncontrollably. She's holding on to you. Now, did you lose a child? No. The mother lost the child. This isn't your child. But yet you feel such deep pain for the mother and her loss, and deep pain for the fact that you weren't able to be successful with the child. And you begin to hurt and you have this extreme emotional pain, but it's not your pain. You didn't lose the child. You're experiencing the pain through the mother. That's an example of compassion fatigue. It's centered around compassion and empathy. Sometimes compassion fatigue can occur after a single incident, but many times it's cumulative. Over time, just this constant hurting that we have to deal with in our profession leads to this compassion fatigue. Now, burnout is a cumulative process marked by emotional exhaustion and withdrawal. And if I just try to simplify it, it's just where you don't like your job anymore. You've lost the joy in doing your job and caring for trauma patients and in working where you work. It has a gradual onset over time. Burnout can occur because of PTSD. It can also occur because of compassion fatigue, but it can also occur just because of a difficult workplace. And we can become burnt out without PTSD or compassion fatigue. And also note that not everybody with PTSD or compassion fatigue becomes burnt out. While they frequently lead to one another, they are separate and you can have them without each other. So what are some of the symptoms of these various forms of stress? Well, PTSD is a lot about the triggers and the flashbacks. After you experience it, there's certain things that trigger you, that make you anxious, that make you relive, that give you flashbacks, that bring back anxiety. In the example I gave, it's going by the room where it happened, or even just going to the department where it happened, and you get this extreme anxiety. And that's kind of a lot of what PTSD is about. You feel sad, fearful, or angry, detached, estranged from other people. And you, over time, will tend to avoid situations or people that create those triggers or memories for you. It's not uncommon for people to become very socially isolated with PTSD and for the triggers to start to cause alienation. Now, compassion fatigue can manifest in many ways. You can become very burdened by the suffering of others, isolate yourself, lose pleasure in life, have difficulty concentrating, insomnia, physical, mental fatigue, bottling up emotions, feeling hopeless or powerless, complaining about work or life, excessive use of drugs or alcohol, poor self-care. There's a good chance that a few of you watching the video may start to say, is that me? Yeah, it can be. It happens to us. Now, burnout, of course, is going to be job-related, feeling exhausted or overwhelmed, loss of job satisfaction, frustration, cynicism, disconnected from others, lacking feelings and indifference, depression, needing alcohol or other mind-altering substances to cope, all signs of burnout. There's one symptom that's actually common to all three of these, and that is denial. Denial occurs in all three of the ones I just talked about. And the reason I mention that is twofold. Number one, because we tend to deny these. If people have them, they'll do all they can to deny they have them. Then the responsibility to help people recognize they have these is to talk to them. If you have a coworker that you believe might be suffering one of these, they probably won't admit it. They're going to deny it. It's part of that disease process. So you have a responsibility to go to them and say, I'm concerned, and this is what I'm thinking. They may not like it because it is denial, but sometimes that's the way we have to break through the denial. But the other side of this is if you have a coworker or a family member come to you and say they're concerned that you may have these symptoms, maybe listen and do some introspection. Could it be that you are experiencing these and you are suffering from denial? So just kind of bear that in mind. So that brings us back to our challenge question. Ready? The symptoms of compassion fatigue are most likely to be, so here we go, evident after a single traumatizing experience, transient and worsened during nighttime hours, delayed 3 months or more after the causative incidents, or identified by coworkers before the individual experiencing them. Now, as I look at this, I'm like, two of these could be correct. However, one of them is partially correct and one is fully correct. And can I just warn you up front that on the exam, you may see questions like this more than once where you're like, more than one of these could be right. But remember that the essence of answering a multiple choice question is to pick the best answer. So when you have things sometimes that look more right than others, which of the choices you have is the most right, the easiest one to pick? Now, if you're like me, I'm saying, well, it could happen after a single traumatizing experience. That is true. However, it's often related to accumulation, right? It's over time. So A, while it could be correct, it's kind of a, well, it could be this or that. So it's only partially correct. But D, identified by coworkers before the individual experiencing them, because denial is part of compassion fatigue, it's almost certain that that one's going to be correct. There's no ands or buts or anything to that. So of the two, A or D, D is definitely my choice because it's the most right answer. I don't have to explain it away. I don't have to pretzel my way into it. It's just an easy, that's the correct answer. So do remember that. Sometimes more than one answer is going to look correct. And when it does, you're going to want to pick the one that's the most right, the one that requires the least explanation. It's just the easiest to go with. Make sense?